It's described as the invisible challenge. Chronic pain is, and it's one of the affects millions of Australians. It's a pain that lasts longer than 3 months and often goes untreated.
Well, tomorrow marks the start of National Pain Week, a time to raise awareness of chronic pain and how to treat it. For more, we're joined by Coralie Wales, President of Chronic Pain Australia, and Mary Lynn Cochrane, who's lived with chronic pain for decades. Good morning to you both. Thank you very much for joining us. Nice and early. I'll begin, Coralie, with it seems to be, we're talking about this as an invisible challenge, and perhaps it is unreported because many people are keeping it to themselves, but it seems to be a growing issue in our community.
It's probably the most emergent problem that we have as a society.
What are the factors behind that? Is it to do with perhaps an ageing population, lifestyle?
Well, we are ageing, and certainly as we age, if you're older, you're more likely to have chronic pain, but many children and young people have chronic pain too. I think the main problem has been that medical practice hasn't really had a good way of identifying chronic pain. It's different to acute pain. It's long term, so many people don't want to talk about it. It's not very sexy. And as your life starts to kind of cave in because you can't do things, people get quite depressed and isolated.
Mary Lynn, you do want to talk about it because so many people do suffer from it. Just tell us a bit about your own story.
I began feeling chronic or suffering from chronic pain when I was in my early 20s. And I've had multiple surgeries, about 20 major surgeries now. And living with chronic pain has been challenging. As Coralie said, it's very challenging, and it's also not only the pain of experiencing the pain, but it's all the other things, the symptoms of the pain that go with it, the depression and the isolation, not feeling that, you're contributing. So I've had, my journey so far has been mainly, for the most part of my 40 years with pain, has been medical intervention, medications and surgeries. And it's only been in the last 5 years that I've learnt to live with chronic pain and be able to live a quality life with it.
You say that you feel isolated. Is that because perhaps other people don't understand what you're going through?
People don't understand what it's like to suffer pain and to be in pain because they don't understand pain, I think. And people understand the short-term acute pain, as you're talking about before, where you can, stub your toe or, have a broken limb or something. But this lasts all the time. So, yes, they don't understand, but you're isolated because you're holding everything in all the time. You try and pretend that you haven't got chronic pain, and you're isolated because you're off a lot, particularly if you're working. And as I did, I had to change my work because I couldn't do it anymore, because it does stop you from living and just what I used to call a committed quality life, which I'm doing that now in a different way.
Quite debilitating, obviously. And I suppose, Coralie, one of the other factors around the issue with chronic pain is that you can't attribute it to any one thing, can you? It's a diverse spectrum of issues that we would be talking about, I imagine.
That's right, because chronic pain can be caused by a disease. It can be caused by something like lupus or rheumatoid arthritis. But it can also be that you've had your surgery and you've come out and the doctor says, you're fine, my job is done. But then you're left with chronic pain. And the problem with that is that then you're not an expert. None of us know anything about it until we find that it's arrived on our doorstep. So people spend many years, as Mary Lynn has said, many years looking for, how do I live with this? If you're told to live with it, and you don't know how to manage it, that leads to pretty bad places.
So what do people turn to as far as treatment is concerned? How do they get some relief there?
It's been a huge change. Originally, I went just to the doctor and to surgeons and had injections and medications. But in the last 5 years, I've had the best quality of life living with chronic pain, and that's been with doing natural things that are helpful, meditation and relaxation, eating good foods that help me in my condition with anti-inflammatory foods, and relaxation, exercise, stretching. I would go to a physiotherapist at Bounce, and I use them 4 to 5 times a week. I go there. So that's part of my lifestyle. And I've just chosen, like, I could hardly walk around the block. So my goal now with my physio is to walk the Harbour Bridge. And I can't walk the block yet, but so to use a goal and then to work on it. And I'm doing that. So to use what's there. And during this week, it's fantastic because, particularly on Friday, National Pain the Conference, there will be people there who can tell you different ways that, you know, they can help and that you know, have chronic pain and be able to live with it.
I think it's really important, I think it's really important that before that happens, you have to understand it. So chronic pain is really different to acute pain. So when you fall over and you've broken your arm, there is a natural healing process. And it's about the nervous system and the immune system, and they do this lovely thing and they heal you. But in chronic pain, both the nervous system and the immune system have become so active that all sorts of complications and complexities arise. So I always reckon, and the research certainly says, that the more you know about chronic pain, the more you understand your condition, then you can get underneath the radar with it and you can start building up. Mary Lynn has started to sort of take some small steps and building on that. And that's the way people talk about their pain journey, as returning, re-delivering some quality of life.
I now control the pain, it doesn't control me. And that's with this new thinking, you know, that's out at the moment.
You take your power back in dealing with the situation.
Yeah, it's a good way of saying it.
And research has also indicated that weight loss can be a key factor as well in helping to decrease the impact.
Well, I guess it's less load on the joints. And there's less inflammation because, you know, the fat cells in themselves can be inflammatory. We're always really careful about talking with weight loss because if you start then saying, well, what you've got to do is you've got to lose weight, that's another burden. And people in pain are already dealing with an awful lot, and they're incredibly strong people. Living with chronic pain 24/7 requires, over time, you have to get really tough and really resilient.
And losing weight too, I think, you know, it's a whole lifestyle where it's not just losing weight. You have to exercise, and people in chronic pain, I find that really difficult. At the moment, I can't walk around the block, so that's why it's good to try and do those things to do it, and then find out now there's, you know, different thinking on foods that can help different conditions.
Anti-inflammatory.
And is it also about managing expectations, both your expectations of yourself, but also the expectations that others might have of you? Is that challenging as well?
Well, yes, it is. It was for me. Like, I wouldn't tell people I was in pain, and I would, you know, be in terrible pain and pretend it wasn't happening, because you don't want to have your whole life talking about pain. When people ask you how you are, you don't want to say, oh, look, I'm dreadful, I can hardly walk, oh, the nerve pain is dreadful. You know, it's best to say, no, I'm great, fine, thanks, you know.
And so probably it is National Pain Week, so obviously this is all about awareness for the community.
It is.
You were talking earlier about understanding the pain and what someone's going through, obviously not just for the patient, but also for healthcare professionals as well.
I think that's such an important point, because if you don't understand it and you're confronted as a health professional with somebody who's got these ongoing complex problems, if you don't get on board with them, if you don't develop that relationship with that person, a relationship of trust, of understanding, of sharing, you know, the health professional shares their knowledge with the person in pain. If that doesn't happen, most people won't get better. You know, it's the relationship itself which can help or hinder, and research is corroborating that now. So it's interesting. It's complex.
Well, good luck with your goal of walking the Harbour Bridge. Sounds very exciting.
It is.
So Mary Lynn Cochrane and Coralie Wales, thank you very much both for talking to us this morning.
Thank you so much.
Thank you.